We're back with another edition of the Ministry of Health's Week in Review. Stay tuned for the highlights from the past week's activities. On Saturday, April 20th, Minister of Health Honorable Dr. Frank Anthony attended a cardiology symposium with several healthcare practitioners from both the public and private health fraternity. The health minister, during his remarks, said that within the last 3 years, the public health sector has seen massive improvements in cardiology with the establishment of 25 telemedicine sites, electrocardiography machines at all regional hospitals, and the Hearts Initiative implemented in 171 health facilities across Guyana to improve treatment and care for patients who are living with hypertension. Minister Anthony went on to say,
"We have people who are following guidelines, but the challenge now is to make sure that we get our patients to comply so that we can see better outcomes. And that is something that maybe we need to think about, how we can improve patient compliance so that we can get these better outcomes."
On Sunday, Dr. Anthony participated in an autism walk aimed to raise awareness and highlight the need to help improve the quality of life of persons with autism to lead full and meaningful lives as an integral part of society. The minister, while delivering remarks, said that many families across Guyana are affected by this condition and more attention should be given to providing better and improved care.
In the public sector, we have been working now to encourage and to expand the services that we offer. We have seen that organizations like Samir, Uniquely Me, has stepped in and have over the years been offering a range of services. And I want to commend them. So now in the medical sphere, a lot more work is going on in terms of getting a better understanding of how the brain functions and what can be done in some instances. How can we change what is going on in the brain and how to make people feel much better. And so we are getting a better understanding. And I think that is important so that in the future, we'll be able to help many more children so that they can live a normal life.
Following this activity, he delivered brief remarks on Tuesday at the Climate Change and Health Orientation Training Workshop for CARICOM youth ambassadors and youth leaders. This event, which was held at the CARICOM Secretariat under the theme Youth Empowerment Participation, Strengthening Climate-Resilient Health Systems in the Caribbean, saw the presence of youth ambassadors from various countries across the Caribbean. Dr. Anthony, in his address, said that the effects of climate change affect natural systems and livelihoods and cause extreme droughts, water scarcity and sanitation, and food production challenges. He further said that the change in climatic conditions also place populations at risk for infectious diseases such as malaria, dengue, Zika, chikungunya, among others. Later this day, Minister Anthony attended the Guyana Global Fund Country Coordinating Mechanism meeting on the HIV/TB funding request for January 2025 to December 2027. This meeting was geared at providing an overview of the funding request development process, discussing the resources and evidence consulted, presenting modules developed for the funding request, and considering key strategies for its implementation. Meanwhile, on Wednesday, the Ministry of Health signed a memorandum of cooperation with the Ministry of Natural Resources, Guyana Geology and Mines Commission, Guyana Gold Diamond Miners Association, Guyana Women's Miner Organization, Ministry of Labor, and the United States of America Embassy. Under this agreement, the Ministry of Health and the partnering stakeholders pledged to collaborate in targeting vulnerable populations for malaria elimination. This aim is to reduce the cases of Plasmodium falciparum, the parasite causing malaria, by 2025 and achieve malaria-free status by 2030, as determined by the Ministry of Health in recognition of Administrative Professionals Day Tuesday, the Ministry of Health hosted a luncheon to interact with the staff and give brief remarks to acknowledge their contributions and dedication on Wednesday. During his brief remarks, Dr. Anthony urged the staff to strive for constant academic improvement as the ministry remains committed to creating avenues for training opportunities for all its staff, including administrative professionals. This is the end of this week's review. Thank you for staying with us. Remember to stay informed by following the Ministry of Health's Facebook page for all your health updates. Stay safe